Hello, my name is Amy Sturkey. I am a pediatric physical therapist. I'm here with Jack, and Jack is 13 years old, and he's got spastic quadriplegic cerebral palsy with severe involvement physically due to cerebral palsy. He's going to have scoliosis surgery because he has a 65-degree curve in the next couple of weeks. And when there's a scoliosis surgery, they get a 60 to 70% improvement in the curvature of the spine in the sideways direction. And in the rotation component, on average, you get about a 53% improvement. So there are muscles now on his body that are tight and cranked down that are about to be really stretched out. So one of the things I really recommend is start working on getting some range in those muscles to be able to make it more comfortable for after the surgery. So because of Jack's surgery, scoliosis, he is shortened on this side, and there's a rotation component, so his legs fall off windswept toward his left. And one of the things you want to work on is lower body, lower trunk rotation. So I want to try to take his legs and take them to the opposite side. So I'm going to hold this shoulder and take his knees off to the other way and see how far I can go. What I often find I do is before I get to end range is I kind of oscillate a little to try to get that muscle to relax before I go all the way full into end range. So let's see if I can just go a little more. I would tend to hold this, anywhere from 20 seconds to a minute. Now the research on stretches with children with cerebral palsy, short-term stretches, are not super, but with the surgery coming up, I really want to do anything I can to increase that range, just to make it less likely that he has muscle spasms in his back after the surgery. So there's two ways to approach this stretch. One is to do the classic stretch. You're tight in this direction, so we're going to stretch in this direction. The other way is to do it from a TMR perspective. That's total motion release. And in that one, what you do is, if he's tight in this direction, you go to that direction and you go as far as you can possibly go and stretch him out. Well, I don't know if it's a stretch when you're going your easy direction. And the thought is that you're relaxing all these muscles over here that are tight, and that you are allowing them to relax so that in a minute we can stretch them. Now, if I wasn't doing this for a video, I would hold this for longer periods of time. But because we're doing it for a video, I'm just going to go ahead and try taking them the opposite way and see if I can see a difference. Now, Jack, that's amazing. I just did that before, and we didn't go near this far. In fact, I'm so far that I'm about to hit his knees on the wall behind us. Again, what I'm seeing when I did the total motion release before, even for a little teeny tiny bit of time, afterwards, I'm getting a dramatic improvement in that range of motion afterwards. Especially with the surgery coming up, knowing these muscles are going to get really stretched. Even short-term stretches, I believe, are important to help increase the blood flow to these muscles and get them ready for the big stretch that's about to happen. I hope this is helpful for you, and we'll look forward to seeing you next time. Thanks a lot. Bye-bye.
If you liked this video and would like to be notified by email when the next video comes out, click the subscribe button here and click the golden bell icon and ensure notifications are enabled on your account.